Good afternoon, everyone, and welcome to today's webinar. My name is Tony Swafford, and I chair our COVID-19 task force at Adams and Reese. This team is made up of members from a variety of disciplines that are affected by the current global crisis. Our goal through the alerts we're doing and webinars like today is to try to get information to our clients in a concise manner to help you deal with these times of uncertainty. Along those lines, today's webinar is designed to address questions that we've been receiving and counseling clients on a daily basis. I'm pleased to introduce our presenters, Rouchell and Margaret Myers. Both Greg and Margaret have extensive experience in the area of employment law. They both are engaged routinely in counseling of employment law issues of all natures. And I've had the opportunity to work with both of them in a variety of circumstances, including litigation. And that's what makes these guys so great. They not only counsel clients, but they've litigated these matters. They know the ins and outs of issues that can lead to litigation and to try to help clients avoid litigation. Greg is a partner in our New Orleans office. He's the team leader for the firm's L&E team. He's going to focus today on new legislation affecting employers. Margaret's a partner in our Nashville office, an active member of the L&E team. She's going to talk about what employers should do if an employee tests positive. With that, Greg, I'll turn it over to you.
Thanks, Tony. I appreciate it. The first thing I want to say is that this is a fluid situation and that circumstances are changing on an almost daily basis. But as of today, this is where we are in terms of legislation. The first thing I'm going to talk about is the Emergency Family First Response Act. Next slide, Margaret. For those of you who are wondering how we got here, I thought I'd give a little bit of background. Last Friday, the House passed a bill that would provide for paid sick leave for employees of small businesses. The bill went to the Senate, who had some concerns, so the bill then went back to the House for what are known as, quote, technical corrections, end quote. The bill then went back to the Senate, where it was reluctantly passed Wednesday, and then it was sent to the president's desk for signature, and he signed it Wednesday night. The reason I say it was reluctantly passed by the Senate is because the Senate has admitted that the bill does in fact have problems. Namely, it does not go far enough to provide enough relief to the businesses themselves. It's entirely focused on the employees. But the businesses themselves are incapable of paying for what the law now provides, and many of our clients are expressing frustration in that regard. Although there are tax credits, the general sentiment is that such relief is going to be too little too late for many small businesses. Reports indicate that the Senate is working on its own relief bill that would complement and be in addition to this new legislation and would be aimed at providing more immediate relief to small businesses in the form of available cash. So that's some good news for those of you who are concerned about this new law. But that's not where we are currently, so let's talk about the current state of where we are now in terms of what is going to be legally required of certain small businesses. Next slide, please, Margaret. The first component of the new law is the Emergency Paid Sick Leave Act. Next slide. First of all, it's only temporary, and it's going to expire by operation of law on December 31st, 2020. I have received many questions about how the term employee is defined in the new law. This law is going to apply to pretty much every conceivable type of employee because the new law utilizes the same definition of employee that is used in the Fair Labor Standards Act. So if the FLSA applies to you, this law is likely going to apply to your employees. Another question I keep getting are what types of employers are excluded, if any. So let's go over the definition so that we can address that issue. If you are a private entity or individual who employs fewer than 500 employees, this law applies to you. It's also clear that it applies to federal workers. One issue we're looking at right now is whether this new law applies to all public employees at the state level. We're going to put together and we'll distribute more information on that issue once we complete that analysis. Before getting into the law, I want to note that many folks are under the mistaken impression that the new law is inapplicable to employers with fewer than 50 employees. That's not true. The law still applies to you. However, there is a provision that states that the Secretary of Labor has the authority to issue regulations for good cause that would exclude certain healthcare providers and emergency responders from the definition of employee. And it also allows those employers of healthcare providers and emergency responders to opt out if they want to. The Secretary of Labor will also have the authority to issue regulations that would exempt small businesses with fewer than 50 employees from having to do this, but that would only be the case when the requirements of the law would, quote, jeopardize the viability of the business as a going concern. So I think people need to be cognizant of that fact, that it's not automatic just because you have fewer than 50 employees that this law is not going to apply to you. The Secretary of Labor has yet to issue the regulations. Perhaps they're in the works, and we'll know more about that soon. But the way it's written now is that the law applies to you even if you have less than 50 employees. It'll be interesting to see what the Secretary of Labor's guidelines say in that regard. Another common question we've gotten is whether the new laws will apply to nonprofits. The answer is yes, based on our review of the legislation. The fact that nonprofits do not pay income tax is not really relevant because the tax credits to employers is for employee payroll taxes, which even nonprofits are required to make. So we're going to talk more about the tax credits in a bit, but I wanted to address that issue before we get started. Next slide, please, Margaret. So let's dive right into the scenarios where the law is going to be triggered and apply. For paid sick leave, it states, an employer shall provide to each employee employed by the employer paid sick time to the extent that the employee is unable to work or telework due to a need for leave because of, and there's 6 reasons, and we're going to go over each one right now. The first triggering event is the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. So what that's envisioning is the government specifically orders folks to stay home and self-isolate or self-quarantine for a period of time due to COVID-19 related reasons. Under that scenario, you're going to have to pay your employees their regular rate of pay or minimum wage, whichever is greater. It's capped at $511 per day and $5,110 in the aggregate per employee. The second triggering event is going to be where your employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So what is that envisioning? That's envisioning an order of a doctor telling someone you have to stay home because of the coronavirus. It does not necessarily mean that your employee is tested positive for the coronavirus, because testing is limited and we have a short supply of testing kits. So the law was specifically drafted in such a manner that it does not require a positive test result. But what it does require, I think at a minimum, is an order from a doctor that you have to stay home. And employers should be cognizant of the fact that it's perfectly acceptable to request a doctor's note from your employee for this particular triggering event so that you know whether or not the request is legitimate or not. The amount of pay for this triggering event is going to be the same as the other. It's going to be the greater of their regular rate of pay or minimum wage, whichever is greater. It's capped at $511 per day and $5,110 in the aggregate per employee. The third triggering event is the employee is experiencing symptoms of COVID-19 and needs to seek a medical diagnosis. So this is basically your employee says, I'm not feeling well and I want to go to the doctor. You got to honor that request. You got to allow them to go to the doctor, and you're going to have to pay them for the time off that they need to take in order to go to the doctor to seek a medical diagnosis. You're going to have to pay them the greater of their regular rate of pay or minimum wage, whichever is greater. Again, the cap is $511 per day and $5,110 in the aggregate. The fourth triggering event is the employee is caring for an individual who is subject to a federal, state, or local quarantine or isolation order related to COVID-19, or the employee is caring for an individual who is subject to an order by a healthcare provider to self-quarantine due to concerns related to COVID-19. So basically what this is it's not only providing coverage for the employees themselves, it's also providing coverage for employees who need to care for an individual who is subject to the quarantine order. So it doesn't just apply to employees, it also applies to individuals that they need to care for. The amount of pay, though, for this is lessened for employers. It's only 2/3 of their full salary or minimum wage, whichever is greater. There's a $200 per day cap, and a maximum benefit of $2,000 per employee. The fifth triggering event is the one that most employers have had the most questions about, and we're going to delve into this one much deeper in a few minutes when we talk about the amendments to the FMLA. The fifth triggering event for paid sick leave is that the employee is caring for a son or daughter of such employee if the school or place of care of the son or daughter has been closed due to COVID-19 precautions, or the child care provider of such son or daughter is unavailable due to COVID-19 precautions. Under that scenario, you're going to owe 2/3 of their full salary or minimum wage, whichever is greater, and it's going to be capped at $200 per day and a maximum benefit of $2,000 per employee. Again, we're going to talk about this one in greater detail in a minute. The sixth triggering event is sort of a catch-all for the government. It says the employee is experiencing any substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasury and the Secretary of Labor. That's just a generic catch-all. It's not really something we need to discuss here today, but it has the same 2/3 full salary or minimum wage, whichever is greater, and $200 per day and $2,000 per employee is the cap. There's an exception to all of these triggering events, and that applies to an employer of an employee who is a healthcare provider or emergency responder that may elect to exclude such employee from the new law. The term healthcare provider means a doctor of medicine or osteopathy who is authorized to practice medicine or surgery as appropriate by the state in which the doctor practices, or any other person determined by the Secretary to be capable of providing such health services. Another common question we've received is what sort of documentation can we require from our employees? I think in the case of sickness or self-quarantine, requiring a doctor's note is more than reasonable. The law specifically allows that after the first work day or portion thereof, an employee receives sick time under the law. An employer may require the employee to follow reasonable notice procedures in order to continue such paid sick time. So how much leave time is required? Full-time employees can utilize up to 80 hours of sick leave time. So essentially, it's 10 regular work days or 2 weeks. Part-time employees should be afforded the number of hours they typically work on average over a 2-week period. If their hours fluctuate so much that you can't determine this, then you need to calculate the average number of hours per day that the employee worked over the prior 6 months. If the employee did not work for at least 6 months, you use what the reasonable expectation was at the time of hire for how many hours the employee was expected to work if circumstances were otherwise normal, meaning we were not in the midst of a coronavirus pandemic. The law states that in the next 15 days, the Secretary of Labor is going to issue guidelines for how to calculate the amount of wages that are due. So everyone should be on the lookout for additional guidance from the Secretary of Labor. If sick time is needed, the payments are going to stop beginning with the employee's next scheduled work shift immediately following the end of the need for sick leave. One thing I'm getting a lot of questions about, and I want to address now, is that you cannot require that the employee find a replacement for them while they were on leave as a condition of providing leave. Also, it does not matter how long the employee has been employed by the employer in order to qualify. We're getting lots of questions about that. The paid sick leave law is going to apply to all employees, regardless of when they are hired and regardless of whether they are full or part-time. Another common question we're getting is whether you can invoke PTO and other sick leave policies. The answer is no. You cannot require your employees to utilize available sick time before this legally mandated sick time can be used. The new law and its requirements would take precedence over any other existing policy or benefit that may otherwise be available to your employee. There will be required posters for employees that you're going to have to post, where you normally would post your FMLA posters or your workers' comp posters. You're going to have to post something about these laws. A model poster is expected to be released by the Secretary of Labor in the next 7 days, so that should provide a quick resource for employers on what, in fact, they need to post. Next slide, please. You are prohibited by the new law from discharging, discriminating, or disciplining any employee who takes the available leave or files a complaint or institutes any proceeding related to the act or has testified or is about to testify in any proceeding related to the act. This is obviously an anti-retaliation provision that we typically find in other employment laws. If you willfully violate the anti-discrimination provision, or the anti-retaliation provision, I should say, you are deemed to be in violation of the FLSA, and you are subject to penalties provided for in the FLSA for willful violations, meaning that the recovery of the employee is going to be double the amount of wages they otherwise should have been paid under the Act. If you violate the Act, again, it's going to be deemed an FLSA violation. If the employee is lawfully terminated for reasons unrelated to the new law, some have asked whether you're going to have to pay out the sick leave that they have accrued or it's still in the bank, and the answer is no. You don't have to pay that out upon termination. So it's not like accrued PTO that you pay out at termination. It's not going to be treated like that. The Act also says that it's not intended to diminish the rights or benefits that employees would otherwise be entitled to under any other law or employer policy. So what that means is that if the employee needs to take longer than the number of hours afforded to them by the new paid sick leave law, they can take advantage of other benefits. For example, their accrued PTO, or perhaps they have some available sick leave that can be utilized. So to be clear, there's a sequencing component to this. That is, the payments provided under the law need to apply first. And there's a second component that anything else the employee has available to them in terms of additional leave pursuant to company policies can be used in addition to what this law provides. Next slide. Now I want to shift gears and talk about the revisions to the Family and Medical Leave Act. The FMLA has been temporarily expanded to provide relief to parents impacted by school closures. Next slide. So to answer some common questions, this amendment is only temporary. It too is going to expire by operation of law on December 31st, 2020. Another common question is who's covered? Well, any employee that's been employed for at least 30 days can take advantage of this new expanded FMLA leave provision. And the law has been amended to state that it applies to employers with fewer than 500 employees. Next slide, please. So when is leave available? There's been a new Section F that has been added to the qualifying events under the FMLA to provide for leave between now and the end of the year because of a qualifying need related to a, quote, public health emergency, end quote. The Act then defines the qualifying need as follows. It says, and I quote, the employee is unable to work or telework due to a need for leave to care for the son or daughter under 18 years of age if such employee of the school or place of care has been closed due to a public health emergency, or the child care provider of such son or daughter is unavailable due to a public health emergency. Some have asked, what do they mean by child care provider? And what that means is someone that you pay to watch over your kid, meaning the nanny or the babysitter or the daycare center. If you normally have your kid in daycare or at home with the nanny and they can still take care of the kids, this law is not going to be triggered. A public health emergency is defined as a declaration of emergency by the federal, state, or local authorities. So I think we're already there as of today. Most governors and local officials, as well as the president himself, has declared this a national emergency. And of course, many schools across the country are closed. So this is going to impact a lot of employers and employees. And I know this is one of the chief concerns amongst employers, is having to pay up to 12 weeks of paid sick leave because of a school closure. So let's back up and consider what you need to consider as employers. I think primarily issue number one is going to be, has there been a declaration of a state of emergency due to the coronavirus? We can all agree that the answer to that right now is yes. The second consideration is whether the school is closed because of the coronavirus. I think we can all agree that the answer right now is almost yes for everybody who's listening to this. So then the next step for you as the employer is to assess whether the circumstances are such that the employee truly cannot work because of the school closure. What I mean by that is you, the employers, are free to ask your employees some questions. For example, Are there others at home with the kids that are taking care of them? What I mean is there someone already at home, like a spouse, a babysitter, or a grandparent? In other words, the relevant analysis is not whether the school is closed, but whether the school is closed and there's no other option. At least that's what my position would be if I'm faced with this issue. In other words, I don't think Congress envisioned a scenario where both mom and dad are at home on paid sick leave because school is closed. If one is on sick leave, that means they're at home taking care of the kids and the other can still work, and therefore this law would not be triggered with respect to that other parent. Even if there is no one else at home that can take care of the kids while school is closed, I think a relevant question would be, can the employee still work from home or telecommute and still be able to look after the kids while school is closed? If the answer is yes, then the employee can work, and therefore, again, this law is not triggered. So in my view, the only time this law should apply, and I reserve the right to change my mind once the Secretary of Labor issues his regulations, the only time I think this law is going to apply is if school is closed and there is literally no other option for the parent other than to stay home, and while they are home, they cannot work remotely. So you as employers need to be thinking about the kinds of questions you need to be asking of your employees in order to properly vet any request to stay home because of a school closure. Many are panicking, thinking that just because schools are closed, they're going to be obligated to pay sick leave under the expanded definitions under the FMLA, and that's not necessarily true. There's a variety of factors and considerations you need to take into account before the requirement or the legal obligation would be triggered to provide this benefit. Turning now to some of the other issues that we've been hearing a lot about related to the FMLA. Like the paid sick leave law, the Secretary of Labor can exclude certain healthcare providers and first responders, and their employers can opt out of this legislation. And like with the Emergency Paid Sick Leave Act, the Secretary of Labor can also exempt small businesses that have fewer than 50 employees when compliance with the law could jeopardize the business as a going concern. Again, like you're about to go out of business, or you're going to have to declare bankruptcy in order to meet your financial obligations with regards to this law. But again, that has not happened yet. So technically, this law applies to employers with 50 or fewer employees, and may at some point in the future, you'll be able to get some relief if you can prove that you cannot afford to comply. There is one helpful provision that I want people to be aware of, and that is if you employ less than 50 employees, your employee cannot sue you. But that's not to say that you wouldn't have problems with the Department of Labor. But if you have any concerns over facing multiple lawsuits by your employees, if you have less than 50 employees, there's going to be a prohibition for civil actions against employers who violate the act. But again, the Department of Labor would still have jurisdiction to issue fines and penalties. One other thing of note is that this benefit is not available for the first 10 days of leave. The first 10 days are unpaid. During that 10 days, the employee can use PTO or other sick leave that they may otherwise have available to them. But keep in mind that one of the qualifying events under the Emergency Paid Sick Leave law is leave due to a school closure. So in theory, the employee, assuming they have not already utilized all of their paid sick leave under the Emergency Paid Sick Leave law, they could use that available benefit during the first 2 weeks that they need to take the FMLA leave, and then the FMLA leave would kick in for 3 weeks and beyond, for week 3 and beyond if necessary. So how much do you have to pay? Well, the payments owed to employees are equal to 2/3 their regular rate of pay or the federal minimum wage, whichever is greater. Even then, the benefit is capped at $200 per day and $10,000 total for each employee. The calculations for part-time employees are going to be the same that we went over previously. The same rules for using the 6-month average if necessary, and the other ways to determine, that's also going to apply the same way for the FMLA leave. And just like traditional FMLA, the law requires reasonable notice by the employee of the need to take leave. Notice is required when the need is foreseeable, and notice needs to be sent as is practicable. The usual FMLA rules are also going to apply to job reinstatement. If you have fewer than 25 employees, you may be relieved of this requirement if certain conditions are met, primarily related to economic conditions related to your business. So that's the conclusion of my portion of the presentation. I'm going to now turn things over to Margaret.
Thanks, Greg.
One final thing I should mention, that if you can't afford any of this, your options at this point are very limited. The only thing you can do is potentially seek to establish that you are in jeopardy of going out of business if you have to comply with this regulation. I would encourage you that if that is in fact truly the case, that you get as much evidence collected that you can to establish your financial position and your inability to take out a loan. Otherwise, the only other relief you can seek at this point would be to take out a loan, including a loan from the Small Business Administration. But again, I don't want folks to panic, because our understanding is that the Senate is working on additional legislation that is going to hopefully put money in the bank accounts of small business owners in the very near future. Sorry, go ahead, Margaret.
No problem. Thanks, Greg. Okay, so what if you do have an employee that reports testing positive for COVID-19? Some of you may have already been faced with this issue, and others of you may be, it's likely only a matter of time. As more and more tests are done, as we have seen in New York in the last few days, we will have more positive results. So now is the time to get your COVID-19 response plan together. So a couple of quick caveats. One, we are lawyers. We're obviously not healthcare providers or infectious disease experts. Two, the experts, even those experts, are learning more and more about this new virus every day that could change the approach that everyone should take to this virus. So you need to closely monitor what those health experts like Dr. Fauci and the CDC are recommending and saying that employers should do. With that said, what do you actually do if an employee reports with a positive test? So first, with respect to what you do with that employee, is if the employee's at work, when they find out, you immediately send them home. If they're not at work, you tell them to stay at home and not to come to work. Second, you would encourage them to self-quarantine and practice social distancing, but you'd also for sure want to encourage them to contact a qualified healthcare provider as to what their next steps and treatment should be. The healthcare provider will need to tell the employee, for example, if the 14-day quarantine period that we would ask that they quarantine or self-isolate and not come to work would be sufficient. Each case is unique, and the length of an employee may be infected is unique, and sometimes it takes people longer to recover. Others, they recover much more quickly and are able to potentially return to the workforce a lot faster. So employers should avoid making a blanket assumption that a 14-day period of self-quarantine is sufficient. A couple of ADA considerations is the Americans with Disabilities Act is one, you want to make sure the employee who has reported that they've tested positive knows that he or she will not be identified by name to their coworkers or to anyone else as having tested positive for COVID-19. Second, if employees ask who it is, which they will, you want to stand firm and say that to comply with the law, we cannot identify the name of the individual who's tested positive. Third, if employees keep asking, is it Johnny? Can you just tell me yes or no? Again, you want to stand firm and confirm or tell them that you cannot confirm or deny who it is. The next step is, actually a couple ADA considerations that just happened today. The EEOC has now revised guidance regarding pandemics and specifically COVID-19 and is now allowing employers to ask their employees if they're experiencing symptoms of a pandemic virus like COVID-19, including do you have a fever, do you have chills, cough, shortness of breath, sore throat. But again, if you ask these questions, you just need to make sure that you maintain any information that you receive in a confidential manner in compliance with the ADA. The EEOC has also just today said that employers can take employees' temperatures during the COVID-19 pandemic without violating the ADA. Normally, taking an employee's temperature would be considered a medical examination and would be prohibited in most circumstances. But in this case right now, it is okay for employers to do, and that is a question that actually I have received several questions on from clients. The next step, you want to actually interview the infected employee and get some information so that you know what steps you might need to take. First, you want to ask, when did you start having symptoms? Where were you in the office when you started having symptoms? When did you test positive? Once you tested positive, hopefully this isn't the case, but once you tested positive, did you come into the office or any of our facilities or any of our clients' facilities or locations? And then two basically general categories, places and people. Where, first you want to ask, the employee as best they can remember, tell me all the work areas in the office, company facilities, locations, where you are physically present for the 2-week period prior to your having symptoms or prior to your testing positive. And this includes not just, make sure they understand, this is not just company offices and facilities, but potentially if they are, frequently in a certain customer or customers' offices or locations or vendor locations, you need to know that information as well. The next category is people. You need to ask them specifically, to the best they can remember, within the last 2 weeks, the names of any individuals that they came into contact with in the workplace at all. And that means, coworkers, that means clients, that means customers, and that means vendors. And this just helps you get as much information as you need to make assessments. Next, you want to determine what the relevant windows of time are that most likely will be a 28-day period, 14 days before the employee tests positive, and 14 days after the employee tests positive. And that's because right now the experts are saying the incubation period for the COVID-19 is about 14 days. So the first window is this 14-day look-back window before there's a diagnosis to help, and that will help you determine the scope of the mitigation efforts that we'll talk about in a minute. The second window is a 14-day looking forward window after there's a diagnosis, and that will help establish the quarantine or self-isolating period for that infected employee, or potentially that could be longer depending on what a qualified health care professional might say. And so, for example, if they tested positive on March 16th, right now they should most likely stay home at least through March 31st, and then potentially longer depending on what a doctor says. So then the next step is mitigating measures. What, as a company, do we need to do now that I have all this information? First, it's important to remember that there's no one-size-fits-all mitigation steps. Do these 10 steps, and that's all you need to do. It's each individual situation is unique. Each individual person, as their job is unique as to who they potentially had contact with, and so that could significantly impact the steps that you may need to take. The first, most important and fastest step is if you find out that someone has been in your office or facility who has tested positive, that office needs to be closed to have all areas where that employee went or was physically present sanitized by a qualified professional in accordance, and this is important, in accordance with the CDC guidelines. You want to make sure that they just don't, go in and wipe a little Windex and that's it. They need to follow the CDC guidelines as to how to properly sanitize that facility. If there's a location, though, for example, say your business has 3 different buildings and 2 of them are 2 miles away from the one building that the infected employee went to, and the infected employee never went to the other 2 locations, then you would not obviously have to close those facilities, but you would have to close the one where that infected employee had been working. 2, you want to contact the employees that the infected employee has identified as having come into contact with. you want to be, calm about it, and again, not disclose who the positively tested employee is, but you need to just make those employees aware that they may have come into contact, or that they did, we understand that they probably came into contact with an employee who is now tested positive, and they need to take, and you would encourage them to take all measures that they deem appropriate. You also want to notify not just the employees that the infected employee came into contact with, but the rest of the employees in your workforce, without causing alarm. You want to just be honest, but again, without disclosing the name of the infected employee, and you want to reassure the employees that you have taken and you will take all necessary steps to make sure that you provide a safe working environment for them. And for example, if you close the facility and it's being disinfected for the next 3 days, and then we'll reopen after that, you can reassure them that, look, we're having a deep clean and everything sanitized in accordance with CDC guidelines, and we will reopen when a professional has advised that is complete. And then you would also want to reassure potentially the other employees in your workforce that at this moment, if they say, well, I don't know if I've had contact with this the infected employee, if I don't know who they are, you can say, look, we have no reason to believe that you have come into contact with an infected employee, but if you start to show symptoms for any reason, we would encourage you to seek guidance from a qualified healthcare professional. So what if an employee, so those are the steps that you want to take. And again, you would probably want to, if you do have an employee reporting positive, you would probably want to talk to your employment counsel to make sure that you've taken all the necessary steps for that particular situation to properly address it. The second type of scenario is an employee reports having been exposed to someone who's been positively diagnosed with COVID-19. You want to go through kind of the same interview process and find out things like, what was the level of exposure to that employee or that person. It may not be an employee, it may be a family member or friend or somebody else. Is it immediate family member? Is it someone that they live with, every day? Did they have regular interactions with that person? Or were they just, in the same room and they saw the person across the room and didn't have any close contact with that person, but they did learn that person tested positive. Obviously, if you see the person from across the room, that may not require you as an employer to ask that employee to self-quarantine for 2 weeks. However, if it is an immediate family member or somebody that they have regular or very close contact with, I would send them home as a precautionary measure for a 2-week self-quarantine period. You would also want to ask that employee if they have been in the office facility, after being potentially exposed, just so if others start potentially developing symptoms, and if they've been in close contact, you would want to with the infected employee, again, you'd want to make sure that they stay away from the office and self-quarantine. And you'd also want to ask them to keep you posted on their status and whether they start to show symptoms, and what their return to work potential status is. So that leads to the return to work. What if, and this isn't, a lot of people aren't facing this quite yet, but they will be facing it at some point, is an infected employee has COVID-19, wants to return to work, and claims to have recovered. What do you need to do? First, you want to require the employees returning to work to provide a doctor's note stating that they are fit for duty and that they're no longer, contagious. Fit for duty would assume that they are no longer contagious. I would note that both the CDC and Dr. Anthony Fauci, who is, I'm sure many of you have seen over the last few weeks, who's the top American infectious disease expert and director of the National Institute of Allergy and Infectious Diseases, he has said, and the CDC have said, that if a person tests positive for COVID-19, that person should be released from quarantine or isolation, and thus for employers, allow the employee to return to work only if the patient / employee is free from fever without the use of fever-reducing medications, the patient is no longer showing any symptoms, including a cough, and the patient has tested negative for COVID-19 on at least 2 consecutive respiratory specimens collected at least 24 hours apart. So that's what the CDC and Dr. Fauci are currently saying. So that's it. There's a lot of moving pieces to these issues, and the situation is constantly changing. But those are just an overall steps of what you need to take, steps you should take to try and help protect the infected employees as well as your other employees in your office spaces. So with that, I appreciate your time, and I turn it back to Tony.
Thank you. Thank you, Greg and Margaret. In wrapping up, we hope this general overview has been helpful to everyone. However, I would encourage you to remember, as most of you know, in the workplace, every case presents its own challenges. And in that regard, we encourage you to get with your employment counsel if you have specific questions you're addressing. Also, as both Greg and Margaret noted, things continue to move quickly at both the legislative and regulatory levels on a national, state, and local basis. Along those lines, we will continue to provide information to you through alerts and webinars as things unfold. Thank you for listening in today, and have a great day.